Gynecology.
Okay, well, I think I found like the one thing you don't know much about.
And then there's Hillary.
Oh, Hillary, yes.
Hillary's a mess, and we're going to talk about her for about 30 seconds here. Hillary, we miss you.
And I work Monday through Thursdays doing the wound clinic.
It's been really a pleasure bringing my foot in to see you.
It's kind of fun. It's one of the places in medicine where there's still a lot of art of medicine as opposed to things that have become more algorithmic. We do hyperbaric oxygen therapy. So there's good data in using it in wound healing because you basically put the patients in a chamber and lock them in, pressurize them with
Breathe oxygen.
and they breathe 100% oxygen. It's not a treatment for the cancer, but it treats the aftermath of the radiation. And then on Fridays, I'm a gynecologist. That's how I'm your gynecologist.
You're my you're my gynecologist. Dr. Laura here is going to talk about gynecology. Wow.
You mentioned earlier how important education was, whether
Sure.
it's in wound care or in this. And so that's probably one of the most important things is we do a lot of education. My partner, Dr. Kate Stambo, and then our chairman, Dr. Nirvana Manning, the three of us do a program called Girlology. And so we do these big seminars in the state. We're actually doing one this weekend
really?
at UAMS, where we talk to girls and they bring a parent or trusted adult with them and talk about what changes to expect in their body and just to learn about it from a scientific perspective and hopefully engage them in conversation with their trusted adult about, how to open up about some of these things that may seem embarrassing, but so that they actually make good, smart choices and know how to sound educated and learn about their bodies in a smart way rather than just looking to Google and maybe finding out misinformation. So.
Hi, everybody. This is Tom Wilkins. Welcome to TomCast. So I have a special guest tonight, and I say literally tonight because it is dark outside. It's beginning there, and we are going to introduce a friend of mine who's looked more at my feet than she has my hands or my face. Is that fair to say?
Fair to say.
Where did hands come from? I don't know. We're going to start this over. Hi, everybody. This is Tom Wilkins. Welcome to Hi, everybody. Welcome to TomCast. This is Tom Wilkins. I have a special guest, and we're going to come right back, and I'm going to tell you who it is.
Do you hate waking up in the mornings? I know I do. That's why today's sponsor, StrongCoffeeCompany.com, is totally relevant to us and our show here at Sweet Pea Productions. We literally live off coffee, and we couldn't do this job without it. But the difference between regular coffees and Strong Coffee Company is that they're like a health conscious thing. So they have these special proteins in the coffee that actually make you not crash later on, which is a huge deal. If you're a caffeine addict like me, you know that afternoon push is just horrible. So they have special coffees that have these special proteins that actually don't cause crashes and are good for you. So if you would like to get 20% off your first order, go to strongcoffeecompany.com/discounts/Tomcast and use our promo code to get 20% off. And it also helps us here at the channel so we can keep buying more coffee and keep making videos for you. Have a great day.
Welcome, everybody, to TomCast. This is Tom Wilkins. My special guest, Dr. Laura Hollenbach, right? Or is it Bach?
Bach.
It's Bach.
Like beer.
I was going to say like the composer.
Yes.
She goes for beer, I go for composer. Anyway, doctor's here, and how long ago has it been we met? Probably many, many months ago when I first had a little injury that I was referred to you.
That's correct.
I regret that day for the rest of my life. But anyway, they have a business, or she does, over there on, was it Macaulay Court? What is that?
Yes, Macaulay.
You had to think for a second, didn't you? So did I.
Behind Best Buy, that's what I always say.
It's behind Best Buy, and it's called what? The Wound Center?
Yes.
Is that technically what the name is?
It's part of Common Spirit, so it's CHI is like hyperbaric and wound center.
Okay. Well, let's go back in your career just a little bit, Doc. We've established the fact that you are from where?
Like where I grew up?
Yeah, just
I
take
grew-
any of these questions
oh.
here. We'll
I grew up in Alma, Arkansas.
Elma.
Yeah, up by Fort Smith.
Wow. I've actually
Booming
been
metropolis.
I've been through Elma. The entering and exit sign are on the same sign. Just
Yes.
different sides.
Yeah, people usually stop there to get gas or
Yeah.
proms.
Okay. And so you grew up there. Where'd you go to school? In Elma?
I did.
Wow. And high school?
Yep.
The whole 9
The
yards,
whole
huh?
9 yards.
Then
I
what
graduated.
happened?
Then I went to college in Hendricks and Conway.
Hendricks, okay. And what did you go to college for? Did you have a site that you were trying to get to this mark in your life? You just went there for guys, or what did? Come on, Doc,
definitely
open
not
up just a little bit.
Definitely not for guys.
Not
That's
for guys,
where you go
okay?
for guys,
Because you were a
but-
studious type person.
Yes, and then I played volleyball there.
Volleyball, I can see you as a volleyball
Yep,
player.
Did.
Actually,
And then
Did-
I studied economics, so not medicine related.
economics. We're probably doing the wrong show then, aren't we? Because we had one about economics not too long ago. Yeah, it was really not interesting, but it was really it's a neat career.
It was actually one of my favorite podcasts, or economics podcasts.
Well,
so
you're
met
probably
a good
going to
host.
want to watch that. Economic development actually is what we talked about. The friend of mine, Bob Biggers, actually, I believe Bob was the one that talked about economic development, and he showed a PowerPoint the whole time. We never saw his face.
I should have done that.
You probably no. You got a beautiful face for TV. Whatever this is called, podcast is what this is. Anyway, let's get back to the subject. So you went to college, and then what happened?
And then I, midway through there, decided maybe I'd go to med school instead. I don't know. You'll
It just
learn
kinda
this about
happened?
me. Yeah, pretty
I
much.
probably should have read the bio first, but go ahead.
I think I'm one of those people that just goes through a choose your own adventure. And so as you ask more questions, you'll probably realize that I kind of have veered through a few different things.
Right.
So studied economics and then did some research one summer and kind of realized I like the clinical stuff. Had no family background or anyone in medicine, and so it was kind of all foreign to me. So then
Paving new territory,
I just was like, I'll just take the test and see how it goes, like the admissions exam.
right?
So
Now-
I took the MCAT.
The MCAT, what does that stand for?
I think it's medical college admissions test.
You think it is.
Yeah, it's been a long time ago.
Okay. Couple of years anyway.
Yes.
All right.
That.
And you passed it.
Yeah, I did well. And so I was like, okay, I think I'll apply to med school.
So you applied to med school.
Mhm.
Let's go back just a little bit in your family. Do you have any brothers or sisters?
I do have one younger brother.
Okay.
He's in education.
Education.
Mhm.
Okay.
And then he's my only sibling.
Does he still live in Elma?
He does not. He works for the state. He lives in Central Arkansas.
Oh, he's got a real job, unlike you, who got
Yes.
into actually owning a business.
Right.
Yeah.
Yep.
No, I'm just kidding.
So yeah, he's got it.
Okay. Well, interesting. And so, all right. So we're back to you getting your medical degree because you couldn't figure out what else in life you wanted to really get into, right?
Pretty much, yeah.
Yeah. All right. And how'd that work out for you?
Great. I loved med school. I mean, the first part, not so much, but then once we got into the clinical years, then I really loved it.
Okay.
And then actually decided I wanted to go into OB-GYN, or obstetrics and gynecology.
Right.
So loved surgery. And so then went into residency in obstetrics and gynecology,
So
which
have
is how
you,
I'm your gynecologist.
you're my I'm your you're my gynecologist.
Mhm.
I never really thought of it that way, but yeah, we'll circle around back to that. So how did you get into the wound care business?
Mostly because of my family. So I practiced obstetrics and gynecology for, I don't know, a while, from like 2012 to, I guess about 2 years ago.
Okay.
And so, actually, that's not right. 2008 to a few years ago. And then we have 3 girls, and
Wow.
we were busy.
What
And
ages are the girls?
they are almost 16, 14, and soon to be 8. It's like in a few days, if I shortchange her, she'll be really mad. So
So there was a little period there that you were raising the other 2, and then all of a sudden the third one.
well, actually, the
Just-
older 2 girls are my stepdaughters. So
Okay,
they
okay.
we got married when they were about 5 and 3. So
All right.
we've been family for a long time.
And your husband is a doctor too.
Yes,
And what kind of doctor is he?
he's a urologist.
Urologist,
Yes.
which I guess all those gynecologists. There's all kinds of gists in these words, aren't there?
Yes,
What does all the gists mean? Just that you're educated?
I think so. Just
Yeah,
have
me
knowledge
too.
and
That was probably a dumb question, but I'm just hearing all this gist stuff. All right, so then an opportunity came along for you.
yes. So then I was working in Little Rock, so I worked at Children's.
Oh, you did?
The rest of my career.
Got a lot of friends over there.
Loved it, but was commuting here. So when my husband and I got married, I moved to Hot Springs and I commuted back and forth for several years. I guess 8 or 9 years.
So in Little Rock?
Yes, yeah.
Okay.
And so then as the girls got older and were more involved in sports and activities, it just got harder to make it to all their events in the evening. And I took a lot of call. So sleeping in the call room got kind of old. And so Dr. Kleinhens started the wound clinic.
Right.
And he was going to retire, and there wasn't anyone taking his place. And we knew of him personally and socially. And it kind of came up one day like, well, what if you did that instead? And I was like, maybe I'd try it.
Sure.
So
Sure.
then I came and hung out in the clinic with him a little bit, and was like, I could enjoy this. And so lo and behold, I did a career change and took over that role as he retired. And so then I worked Monday through Thursdays doing the wound clinic, and then on Fridays I'm a gynecologist.
For several months, I've been coming into your clinic, and the first time I came in there, I had a problem because of some shoes that I was fitted for that didn't work out so well, and got a little wound on the bottom of my foot. It wasn't anything extremely serious, but it was serious to me because I never had foot problems, and I'm a diabetic, type 2, which that's the kiss of death, so to speak. You don't want to get any injuries to your feet, right? I mean,
Right.
That's safe to say that. And came in, and here you are in your little blue outfit that you have. And do you have different colors for different days of the week, or do I just get the blue one all the time?
You must just get the blue one.
It must have blue one. Okay. So you came in, your staff was extremely friendly and was referred to you by a foot doctor in town. And it probably saved me a lot of grief in the long run. The thing that was kind of strange for me in my case, and it's all about me, so you understand it. The
With
thing that was
TomCast.
strange, it was having a cast every week,
Yeah.
and having one, and a young lady named Nikki. Is
Yeah,
it Nikki?
Uh-huh.
Nikki was the first one that I remember anyway. I think I probably had one or two others, but Nikki was the one that is most memorable with her personality. And she was always had this little round saw, and I never could figure out how she was able to every week just saw that thing just perfectly off. And I'm going, you're going to tear up my leg. I mean, this is going to happen. We had that conversation. She says, have faith, Tom, have faith. And I did have faith. And gosh, that was a little rotator thing, and it wobbles back and forth. And what is that called?
Cast saw.
Okay.
It's very appropriately named.
Yeah, I'm glad I asked. But at any rate, in that particular process, you'd have to take it off to see if my foot's healing or not. Is that correct?
Yes. Yeah.
And it was for a long period of time, and got down where I actually weaned myself off of the cast situation. Then I had a little accident one day when I jumped off of a lawnmower that exploded on me. And then it kind of started all over. But I didn't have to go through the cast part of it because I hadn't injured it as bad, I guess. So that was kind of how we got together, and you'd come in and do your, what are you in there, about 30 seconds or something like that, look at the foot, and you go, yeah, you're okay, go on. No, actually, you spent a lot of quality time in there examining. They measure the wound every week, and in my case, it was about every week. So anyway, I'm just giving you a little bit of background of how we got together. do you really, is that your love doing the wound stuff? Is that something that you thought, you probably never thought you'd be into that field, but you did through your other doctor friend?
Right. Yeah. No. Yeah. I mean, I've grown to really like it. It's kind of fun. It's one of the places in medicine where there's still a lot of art of medicine as opposed to things that have become more algorithmic or, follow, you got to follow XYZ. There's still a
Right.
lot of like, I tell patients all the time, it's a little bit like gardening where you have like, okay, sometimes it needs this, sometimes it needs that.
Sure.
You kind of have to monitor and adjust, and not everything's the same. So it doesn't have like a canned response every time. A lot of things, in your case, if you don't mind me talking about it, I'm assuming since
Hey,
you're
I'm an open book.
right,
We'll show pictures.
right, like a
Go ahead.
smaller wound and not, didn't have a lot of, not a lot of
Severe damage.
right, not a lot of severe damage, not a lot of
Yeah.
complications, not a lot of other things that were keeping it from healing, other than the diabetes.
Right.
Whereas for other patients, they can be quite complex or really large, and then it's pretty fun to figure out how to make something that's really messy look pretty or look normal again.
So I started out pretty, and so I just had
You
to
just
be
had to-
prettier
yeah, you just had to stay
at
that
some
way.
point in time. Okay.
Right.
And I know the first time I came into the clinic, and you have seating for maybe 15 or so people roughly in the waiting room. It was astonishing to me to go, why am I here? Some of these people are not speaking badly, but they're along in the process. When they come in there, they've had a lot of damage to their limbs or whatever the case may be, and some of them or many of them are older. Is that a fair statement to say? But by the time that they get to you, there's been some significant problems with them.
Absolutely.
And I'm sure you've seen some pretty terrible stuff in your career, unlike it might have been before in a different field. But how do you cope with some of that stuff? Because it is kind of sad seeing some of the folks, not all, but some of them.
Yeah, I think to your point, like the skin's an organ, right? And so as we age, it incurs damage, right?
Right.
And then as when you have an acute illness or things like that, it's often an organ that blood gets shunted away from, right? Because it's trying to preserve the vital organs. And so I think that's why we see it a lot more in older patients or in patients who are in maybe the later stages of their life, whatever age they may be. But in terms of the coping, I think one of the things, so in gynecology world, I actually mostly did pediatric gynecology. So I kind of went from like the young into the spectrum to not all of our patients are older, but a majority are.
Yeah, a lot more.
And so to the other end of the spectrum. And I think it's pretty fascinating to hear about their lives. The teenagers, or even the kids, it's fun to talk to them, but they don't have like a lot of stories yet to tell, right?
And they'll probably heal quicker in most
and whereas
cases.
in this like circumstance, we see patients usually week after week or every couple of weeks, and then in the wound stuff. And so you get to know the patients really well. And then also, you get to know their stories. Like I said, as you know, we sit in there and a lot of times we're debriding or we're putting a cast on or we're working. And so it just
There's
gives
dead time.
Yeah, you were always interviewing us, but a lot of times we're
I was. I think that there's, of course, being in the media like I've become in my latter part of my career anyway, I have noticed that there is a lot of where did they go kind of thing. And everybody, you have a very busy clinic, and you will come in and you'll do what doctors do, and they'll look at the wounds and say this is looking great, or we need to do this, or what the treatment, and sometimes you're just left alone though for the cast to heal, not to heal, but to cure, I guess, thing. And I'm sitting in there going, wow, this is what, 15, 20 minutes, I think. You have to just is standard for it to dry.
Right.
And I go, okay, being a media guy, what could I do to lighten this up? Well, you have a TV up there. And it's either, you can either watch an old Western or whatever the case, whatever, they're very cordial. And what would you like to see? And education's everything. education's the thing that I know I need in what my wound care. I'm always inquisitive about this type of injury or others like it, and how you treat it. And if I'm doing something wrong at home, do I not need to mow the lawn when I have a cast on my foot? But we had that conversation a long time ago. I'm an active person. I can't, and you probably deal with active people, and you probably deal with people that aren't as mobile as someone like myself. And that's when it gets probably be tough in the healing process.
Yeah, you kind of get both ends because sometimes the active people, we need them to do a little less, right?
Right.
And then you're like that fine line of like, well, I don't want to, I tell patients all the time, if we just were worried about your wound, we'd just like chain you to this bed and like feed and water you until we got the wound to heal, right? But that's like not real life. And so figuring out that fine line of like how much activity, and it depends on where the wound is, right? A foot takes a lot more brunt than perhaps something on an arm or a chest or something else. So figuring out what they can and can't do. And then on the flip side, for ones who aren't as mobile, making sure they're not getting too much pressure because they're not moving, right? So it's kind of finding that, again, that happy
Finding that
medium.
happy medium. Yeah, I heard one person tell another person, says, well, if you don't do this, you might have to tie you down in a bed in the hospital until this heals, kind of thing.
Yeah.
And stuff like that is reality too, because if people don't want to be healed and do what a doctor says, yes, you've been doing this for a long time now, you know what the answers are. But then you have to run into some yo-yo like myself who thinks they know all the answers. And I like to have fun. I like to talk to people. I like to know more about what makes them tick. And that's why one of the reasons I've been trying to get you in here for a long time. And you go, well, we'll see. But I know you're busy too. And I really do appreciate that. But let's take a quick little break right now, and we'll come back. And I want to talk about, there's another room there that I talked to, not yourself necessarily about, but some of the other people that I've heard stories about, this oxygen chamber kind of dealy bob. What's the name of that?
The hyperbaric oxygen.
No, that wasn't it. Yeah, no, that was it. But I want to come back. I want to come back and learn just a little bit more about that. It's not for everybody,
Right.
obviously. But it's just I'm inquisitive about stuff like that. So I'm going to be back with Dr. Laura Hollenbach. I call her Dr. H. It's a lot easier. And most people do, correct?
They do, yes.
Yeah. And so you understand when I say Dr. Hollenbach, Dr. H. At any rate, we're going to be back in just a second here with the doctor. Thank you. Hold on. Here's a commercial. I'm back with my favorite foot doctor. Of course, she's a wound doctor too. Dr. Laura. I like Dr. Laura better.
That's fine.
But I don't feel right calling you that, so I'm going to call you Dr. Laura. Anyway, at any rate, she actually owns the Wound Center, which is on Macaulay Court. In case you don't know where it is, what's the address? You don't know, do you?
221.
221 Macaulay Court, and that is back there behind Best Buy in that area over there. I am correct. Otherwise, I've been driving the wrong place, and they go, well, come on in, Tom. This is the Wound Center. But anyway, we've been talking. I think where we left off, we were talking about this oxygen machine that I hear about. It says in a different room. Tell me about that. What's it called?
So we do hyperbaric oxygen therapy.
Hyperbaric oxygen therapy. Say that past 3 times. Go ahead and tell me about it.
So there's good data in using it in wound healing, because you basically put the patients in the chamber and lock them in and pressurize them with
oxygen,
and they breathe 100% oxygen.
Oh, they're breathing it.
Yeah, so oxygen's pumped into the chamber. So
no, wait. So I'm inside. The whole body's inside the chamber. My head and everything.
Everything, yeah. It looks kind of like a clear tanning bed, except there's a locked door.
I was in the tanning bed business, so I can remember what that looked like. Yes.
So that's what it looks like.
How long do you stay in this normally? Does it vary?
It varies depending on the diagnosis. So we use it for a few different things, but on average, it's about 90 minutes or a little over.
Really? So long, significant time. And how many times a week do you do that?
Every day.
every day?
Yeah. So that most of the data is doing, 5 days a week for, depending on usually 30 to 40 treatments, depending on what the diagnosis is.
Wow. And obviously there's this for wounds that are a lot more severe than the ones I had.
Mm-hmm.
These are for very severe wounds, I guess is another way of saying it, but it helps the healing process.
Mm-hmm. Yep, we use it for wounds. So there's good data for lots of things. Now, what insurance will cover is a little different, but
Okay.
for certain types of diabetic foot wounds, it'll pay for it. There are a lot of radiation injury. So for patients that have injury to different soft tissues in their body, so common ones we see are like the jaw from like a mouth or throat cancer, or to the bladder or the rectum from like a colon or a prostate or bladder cancer that gets radiation therapy.
So even throat cancer you go in there for?
Mm-hmm. And so the radiated tissue becomes ischemic. It loses oxygen. It loses good blood supply. And so the pressurized oxygen helps to regenerate new blood vessels, increases white blood cells to help healing and decrease infection. It's got several different
Now
mechanisms.
you made a statement earlier that I just now am circling back around, something about if you have a wound on your foot, it deprives the rest of the body's organs. You said something about the rest of the organs. What did you say?
Well, blood flow is like really critical to getting something to heal, right? Because you need oxygen to heal
To
the
heal.
wound, right? And to prevent infection and all the things. So that's why foot wounds are notorious for being troublesome, because they get kind of the end of the blood supply, right? So if your
Right.
heart's pumping it down, it's like the last. And then for people that get like peripheral arterial disease, right? So they get we get plaques in our arteries as we age or with genetics, things like that. And so the legs are a common place to get plaque buildup, down towards the feet. And then your vessels get smaller, the further away from the heart that you branch. And so the small vessels get loaded down with plaque, and then you don't get as good a flow to your foot. And so that's more common in diabetics. That's one of the reasons that diabetic foot ulcers are problematic. It's also common in people that just have other types of atherosclerotic disease. But that's part of what makes it harder to heal.
I can remember the first time I had felt neuropathy. I felt it in a big toe one day, and I went to I don't even know if your place existed back in those days or not. It's been years and years and years ago, a couple decades at least. And I went in there and to the nurse practitioner probably at the time, and I didn't know that it was neuropathy. I thought I just had a toe problem. And come to find out that was the onset for me of neuropathy in my feet. And neuropathy doesn't tend to get better quickly
Right.
or ever.
Yeah, exactly. Or ever.
Or ever. Because once from what I know, talking to people that in the know like yourself, that once the nerves are damaged, they're damaged. Is that correct?
Generally true. There's some things that can help, but a lot of times it's kind of a long-term consequence, especially in the setting of diabetes that occurs. It's not really reversible necessarily.
Now, isn't diabetes, somebody said, well, somebody made the comment recently to me. Of course, I know more than everybody does, right? Just said, oh, yeah, I'm pre-diabetic. And I said, either you're pregnant or you're not. Is that not true?
Actually, not true. Yeah. So there is like a pre-diabetes window. So for type 2, so where you start to see insulin resistance, right? The pancreas is like, I'm having to work harder. I'm having to work harder, but,
Right.
but you're not quite full blown. They have to make a cutoff somewhere of what defines it, right? And so there's kind of a window of like, hey, you're headed that way. And then a clear, like, okay, now you officially are diabetic.
Officially are diabetic. And what's the difference now between type 1, type 2?
So type 1 is an insulin deficiency. So it's usually an autoimmune, like the pancreas stops making insulin, which insulin's how your body takes the sugar and utilizes it. And so type 1, you don't make it essentially anymore. Type 2, then you have kind of worn the pancreas out. So your pancreas makes the insulin. And so you make more and more and more. And so the insulin gets resistant. So it's like it's getting carbohydrate or sugar shown to it, but it's having to work harder and harder and harder to process it. So it's the one that's more commonly associated with age and with obesity and things like that. Is
Right.
your type 2.
Right. Now, I used to play guitar pretty well on level 1 to 10. I was a 12. No, I wasn't either. But I was a decent guitar player, and had a show downtown for 31 years and all that. And it wasn't a few years ago. I have guitars and banjos and all that stuff, and I just sat there and looked at it because of the neuropathy going on my fingers, and it's going, can I do this anymore? After about 3, of course, it's all about me here. You understand that. After about 3 years of looking at them, I picked up a guitar the other day, which is still in great shape, still sounds good, except for the rust on the strings, of course. And it was difficult. It mentally kind of got me, but then the more I did it, muscle memory came back, finger memory came back, whatever style I was doing at the time. And it was like that was a journey that I had in that career. But then I have another journey now in other things. And God, for whatever reason, took that part of it away from me. But still, my point is this. I say all that to say this. Can you go back when you have like neuropathy in your fingers like this? Is there a way to reverse that, or is it just what's done's done?
Yeah, so there's actually different like types of neuropathy. So there's like what we classically think of, which is like your sensory type, right? Which is like what you feel or don't feel.
Mm-hmm.
And then there's actually like motor neuropathy. So where like the nerves firing to the muscles don't work. And so you get like atrophy of the muscles. And then there's more of like an autonomic type that affects like your sweat glands and things like that. And so there's kind of multiple types of neuropathy that impact people, typically peripherally, fingers and feet kind of stuff. And so some of it depends on what type it is, I never thought as much about the sense of touch until I had this job, right? Because we'll have patients who have such dense neuropathy, they'll, we always get on to them for walking barefoot, but, walk barefoot or even something will pierce through their shoe. They'll walk on a nail, not realize
never know it.
not even know it till they see blood and realize that.
Yeah, I'm not to that point, thank goodness. But yeah, I know that feeling.
Right. And so, or even like you said, just get a new pair of shoes. And whereas you'd normally be like, oh, I'm getting a blister, and you take it off and look and put a Band-Aid on it or whatever, you don't realize it until it's like totally eroded through your foot.
Yeah. In my particular case, I had developed calluses on the ball. Is it the ball? Is that the by the toe? Is that the ball? And had a big callus on there, and then it got infected underneath that callus, and so that was part of my new journey trying to get that, and that took a while.
Yeah,
but it was from bad shoe inserts, I guess was the best way to describe that. Okay, so we're going back to the oxygen deal. That fascinates me. We're in this tube getting ready to be fired out of that missile, and it's all oxygen in there, and you're in there just breathing pure oxygen. Is that pretty much it?
Yeah.
I've had a couple friends that have had throat cancer, and one of them's passed away, and I can't imagine, even if back in the day, if that can that help, or you got to take care of the cancer first?
Right. Yeah. So it's not a treatment for the cancer, but it treats the aftermath of the radiation. So oftentimes, people will get radiated, and then that tissue becomes like scarred or hard, and then it can be really hard on people in terms of their jaw and their teeth and their salivary glands.
Right.
And then again, common in like the bladder and the colon to have radiation injury, and they get a lot of bleeding. And so,
is there any more? Is there a common denominator of the type of person you put in there, or is it all just across the board?
Across the board, yeah. So then, because there's also like acute things people will use hyperbarics for. So like initially was treated in terms of scuba divers for treating the bends for people who did scuba diving, right?
So I can understand.
So that's what we say, like, oh, they're on. We call it a dive when they get their treatment. There's like carbon monoxide poisoning. Actually, you can use it to treat that. And so there's several different acute things you can use it for as well. Just in our center, since it's outpatient, we don't do much of the acute care. We really just do the chronic stuff like wounds and the radiation injury mostly.
Okay. Well, I'll get off that, but it's just it fascinates me to even know that
It's
exists.
cool. Yeah, it really is cool. And there's, a lot of kind of boutique idea of it. Justin Bieber popularized it a little bit. Supposedly he has one in his house.
Oh, he did.
Mhm.
I don't.
But, because there's a lot of like ideas that it has some other indications. But again, a lot of it's stuff that's not either there's not great data or it's soft data and insurance won't cover it yet. Because, in theory, it should be fairly cheap outside of, because it's just the chambers themselves are expensive, but really all you need beyond that's oxygen. But you got to have nursing right at the bedside, and because it's just the risk of catching it on fire.
I hearken back to the idea that when you go into a clinic like your own wound center, and you go in there and think, oh, these people are just making money head over fist, and really, I know the other side of the story, and I know that you have to pay for these medicines up front in most all cases, and you've got a staff of what? There's a 10, 12 or more people around that place on a daily basis.
Yeah.
Maybe not exactly that number, but pretty darn close. And some are part-time, some are full-time. Of course, you got the office staff in there also that you have to pay, and that your girls are tremendous at work out there. They do a great job. Then you've got some folks in the back offices there. You've got a pretty large staff.
Yeah. So you spoke earlier, and you were talking, so I wasn't going to interrupt. So luckily, I'm employed by CHI. So CHI manages the clinic,
Okay.
and so, but yeah, I mean, I think that they also are pretty charitable in terms of the care they'll provide. What even for patients who are uninsured or underinsured, and I mean, I think that. You have a good feeling of giving back to people because we take care of a lot of people
You
in
do.
different walks of life, I think. And
Well, you do a great job. We're going to take our last break right now and come back, and we're going to talk about whatever you want to talk about.
oh, okay.
Maybe gynecology.
Okay, yeah, we can talk about that too.
I know nothing about that. Ladies and gentlemen, we'll be back to TomCast in just a second with Dr. Laura over here. I like that new, that
new
befits you better. Dr. Laura here is going to talk about gynecology. Wow. Hi, everybody. This is Tom Wilkins with TomCast again. I have Dr. Laura over here at the Wound Center on Macaulay Court. It's what? What's
221.
that? 221. She knows she goes there, what, at least once a day, right? Do you go early morning and then you stay?
Yeah, I don't know. I feel like I'm always there.
You're always there. Okay. In case she ever goes home, we'll let you know. Anyway, let's talk about your favorite topic.
Okay, well, I think I found like the one thing you don't know much about.
That's right. I know a lot about a lot of things, but not about gynecology.
Yeah. So
go ahead, take it.
Okay. Well, that's what I originally studied, right? Was OB-GYN. So delivered babies, did women's health care. And largely did it because I liked the surgery. And so then after I finished.
Are you a surgeon?
Mm-hmm.
Oh, I didn't. I didn't realize that.
Which is why kind of going into wound care, it was a easier segue because I already spent many years operating and then taking care of wounds, but just from a different perspective, right?
All right.
So, so delivered babies and did that for, I guess, about 4 years. And then I did a fellowship in pediatric gynecology. So I moved out of state for a while and trained to take care of children and young girls, because when you do an OB-GYN residency, you don't get much training in operating on kids.
All right.
So I moved to Cincinnati and did a fellowship.
Cincinnati? That's like in Ohio, isn't it?
Yeah, it is.
Wow.
So lived in Cincinnati for a while and did a fellowship there in pediatric gynecology. And then then came back to Arkansas and started the program in Arkansas Children's. So there was a lady there who had done private practice gynecology for a while, Dr. Karen Koslowski. She was great. She's kind of a legend. And so she spent some of her time at Children's, and she kind of convinced me that I should go do a fellowship and really like develop it into a full program.
Okay.
So then I came back and started the program there, and then recruited some people to join me over time. And then I guess ultimately I bailed and let them take over, and now I took a step back and I'm only there part-time. But I do still really love it. It's just.
So you do go back once in a while?
Yeah. No, so I usually go back 2 to 3 Fridays a month and still do that. Mm-hmm. Yeah. Because I still really love it. It's probably like I love both. They're
Well, sure.
different, but
I
it's
get you out of the
yeah,
clinic kind of thing.
yeah. It's but it keeps some variety. And then we get to do a lot of teaching there. So we still have residents and students and all that.
Now, would you hire someone like myself with unlimited knowledge about all these topics to probably not? We won't talk about that.
Yep. So then, but yeah, so I really like it. We do like girls birth to we see them usually through age 22, and for a variety of different needs. A lot of people are like, I didn't even know that was a specialty.
I didn't know that was a specialty.
Yeah. So turns out little girls and kids have organs too, just the same way adult women do. And so,
Now, when you say little kids, what
Mhm.
age bracket kind of?
I mean, birth to.
Really?
Yeah. So, I mean, sometimes girls are born with abnormalities in terms of developmentally, right?
Okay.
And so we do like some surgical reconstruction on that type of stuff. Then there's a lot of skin disorders and disorders in young girls, with bladder and bowel and things like that that overlap. We see, and then puberty, right? So early puberty and late puberty. And then as they get into adolescence, a lot of the same stuff we do for adult women in terms of menstruation, ovarian cysts, tumors, cancer. Some of the cool stuff we do in terms of for children with cancer, we work on fertility preservation. So if they're going to get a treatment that keeps them from being able to have kids later in life, we work to help preserve their fertility.
Wow, that's a whole topic
Yeah.
in itself,
Yeah,
isn't
so
it?
that's really cool. And then you mentioned earlier how important education was, whether
Sure.
it's in wound care or in this. And so that's probably one of the like most important things is we do a lot of education. Um, my partner, Dr. Kate Stambo, and then our chairman, Dr. Nirvana Manning, the three of us do a program called Girlology. And so we do these big seminars in the state. We're actually doing one this weekend
Oh, really?
at UAMS, where we talk to girls and they bring a parent or trusted adult with them, and talk about like what changes to expect in their body and just to learn about it from like a scientific perspective and
Mhm.
hopefully engage them in conversation with their trusted adult about, how to open up about some of these things that may seem embarrassing, but so that they actually make good, smart choices and know how to sound educated and learn about their bodies in a smart way rather than just looking to Google and maybe finding out misinformation. So
Well, does the CHI, do they have a program similar or?
they don't. Really, this is just I got a grant to start doing it. We got a grant to start it several years ago when I was at the university full time. And so we've kind of kept the program through there and just the three of us doing it. It's through a larger company called Girlology that's nationwide.
All right.
And so they create a lot of the content and then we just are the what's the right term for it? We just present it to the communities and take it to the communities. So
Well, it seems like there's a need everywhere
yeah.
for stuff like that.
Well, and then it's like a never ending continuum, right?
Yeah.
There's always more girls in that age range that need to learn. So and it's really fun.
What would you like to talk about that we haven't covered? I know we've bounced around different things here, but there's got to be something there that you'd like to get out to the public. We've got somebody over in England's watching this too.
Yeah, I mean, I think I don't know. I think prevention and not underestimating how important some of the, especially with your feet. And we mostly talked about the foot wounds, although we do lots of other wounds. But
Sure.
I never thought about it much till I had this job. Right? How much like checking your feet and managing diabetes and proper fitting shoes and all that type of stuff really matters in terms of not only prevention of a wound, but maintaining people's independence, right? You get a wound and you aren't able to reach your feet anymore and you can't dress it and you got to have somebody help you or it leads to amputation and then that really changes quality of life for people.
How do you know when it's getting to that point of amputation? That's scary for a lot of people.
Right. Yeah. I think it kind of depends. Sometimes people come in and it's pretty far gone at what point they felt like they.
Like colorization's bad or
I
what?
mean, sometimes people come in and it's just dead. It's
Really?
just black and dead. Yeah. And, I think whether that's fear of healthcare or lack of resources or
Right.
lack of knowledge,
I've
always
definitely
know.
seen a little bit of that in my life
Yeah.
where people just let it go.
Right.
Let it go, and didn't know how to fix it or couldn't afford to fix it or whatever the case may be. It's always different stories, I'm sure. But
Yeah. So, I mean, I always hate that. I think probably because I've, in both aspects of my career, dealt with people maybe in a vulnerable position, right? To go in and be like, I have this thing that won't heal. I think sometimes people, or a lot of wounds have foul odor or have a lot of drainage and create a lot of embarrassment for people. I mean, yours wasn't like that, but for some people, it really is, a major issue for them.
right.
And so I think that, hopefully we create an environment that doesn't feel like that to people, or that I think our nurses are awesome. I mean, you've met all of them probably at this point, and, I think hopefully make people feel welcome and like, there's not, it's a judgment-free zone, but I think that hopefully creating some trust in their care.
Because once again, it's about education. I encourage people, don't wait.
Yeah.
It's the old thing, oh, this is going to heal. It'll be fine. And all of a sudden, 3 weeks later, it looks, well, maybe it's not.
Yeah.
Maybe I need to, can people refer themselves or do they have to go to a different doctor to go to you?
They can self-refer, and we help get them. I mean, we can help get the stuff that we need from insurance on the back end.
Okay.
And, we're never going to tell somebody, no, we can't see you. It just, sometimes we got a little paperwork to do on the back end.
I understand.
Insurance rules the world, but
I've seen people like myself that probably on the scale of 1 to 10 is like about a 3 or 4 or less. And then I've seen people in wheelchairs literally there, and I'm going, wow. It just makes you stop and go, wow. I'm so glad I'm not there, and I don't want to be there.
Right.
And it's just it's something that I encourage everybody. Go to Macaulay Court 221, 220. See, I've learned it. I'm teachable. Macaulay Court. It's over there behind Best Buy. It's down that street there. What is that? Macaulay Court? Is that what that's called? See, look at the intelligence levels off the chart here. But I used to have at the end of the Macaulay Court is where I took when my girls were young. There was Dr. Frischman had an office. That was probably way before your time, but that was that last building that I don't think's occupied right now. But anyway, you have a beautiful facility. The people over there treat everybody with friendliness and respect, and it's been really a pleasure bringing my foot in to see you, and when the other foot is probably still in my mouth at times, but you have Nikki's the one I remember because she banters back and forth.
She is.
But everybody else, you have a couple of gentlemen that do the same kind of work in there. I can't remember their names offhand, but they're all very, very, you got some good people that work over there.
We do. We have an awesome staff.
You really, really do. And there's been, of course, there's another lady that has glasses, blonde. Do you know what I'm talking about? That has taken me back a few times.
Okay.
And then there's Hillary.
Oh, Hillary, yes.
Hillary's a mess, and we're going to talk about her for about 30 seconds here.
Yeah, we would not be doing justice to not talk about Hillary.
Well, Hillary, we were afraid that she was supposed to be here originally. Hillary, we miss you, but hopefully we can get her in here sometime with you, and we can talk about other aspects of this. But Hillary, we had to buy a special filter for the microphone.
Yes.
Because she tends to go south pretty quickly. Is that
she needs some bleeping.
She needs some
Yes.
cleaning up, and there is a class that I'm going to start about that too, and we're going to go ahead. It'll be a video made for TV that will feature her in.
Okay.
But I hope that honestly, Hillary, if you're out there, which I know you will be watching this, I hope you feel better. She's come down with a little something. Yeah, you've got some really good people working for you, and she'd be very, very proud of that. And you got a great practice. I wish you well. And I just saw you yesterday, and you come in. You still here? I stayed the whole night, and I thought, well, I want to get in first thing in the morning. So at any rate, thank you.
Yeah,
I appreciate it very, very much. And this is Tom Wilkins with TomCast. You're going to watch this now.
I will watch it now.
You're going to sit down. It'll be on the
I'm
air.
gonna watch myself, though.
Well, I don't care if you watch yourself. Just watch me. That's the more important thing in this. But thousands of people are going to be interested in this topic, and we're glad that you came in.
Yeah.
Thank you, Dr. Laura.